বলবে তো?
You are live. Start.
Good afternoon, everybody. I am Niti Molla, librarian of Krishnath College and convener of this webinar. Let me wholeheartedly the first webinar in Krishnath College. We are here in the environment of during our lifetime. The frontline warriors such as doctors, other workers, are facing the burn which is directly visible. But there are other sections of our society who are in the receiving end and suffering severely, but not so much visible. They are our children, students, teachers, and others. In this situation, they are facing severe mental health problems. Under this ambience, Krishnath College decided that a webinar on the restoration of mental health and hygiene in COVID-19 affected world will definitely address the issue and put forward some remedies. This is certainly, I think, a timely decision. Now, I would like to invite our dynamic and creative principal, Madam Dr. Sujata Bagchi Banerjee, to deliver welcome address. Before I hand over screen to Principal Madam, I would like to also announce that Dr. Shondip More, Assistant Professor of our college, will conduct rest of the program. Thank you for listening. Now hand it to Principal Madam for welcome address. Madam, you are not.
Okay, ma'am. Hello, madam.
Hello, audible?
Yes, ma'am.
Very good afternoon, everybody. Welcome all of you in our first webinar of Krishnath College. Today is World Environment Day. Today, in our
Hello, ma'am.
Hello,
Please.
audible?
Now, yes, now, ma'am. Continue, ma'am.
Hello,
You are audible.
Yes, ma'am. Yes, ma'am. Don't mute, ma'am. I just wait. Yes, ma'am. Continue, ma'am. Continue.
today our name of our webinar is Restoration of Mental Health and Hygiene in the COVID-19 affected world. I am Dr. Sujata Bagchi Banerjee, Principal of Krishnath College, Bahrampur, Murshidabad, West Bengal. Eight years old heritage institute. It is now upgraded as a university. Today, in our lockdown period, in COVID-19 panic and its reaction, we are looking every day in social media, the death list, report of grave situation of the world, impacts of severe mental trauma in our lovable world. Every time we are thinking in our family, market, workplace, a new world, as social distancing, clean your hands. But in this time, friend, don't not only cleaning our hand, we like to clean our mind. So we get our opportunity to discuss our today we welcome Dr. Ranjan Bhattacharyya and Psychiatry, HNAMS Associate Professor and HOD of Medical College, and Dr. Shnaoli Chakraborty, Acharya, Assistant Professor of Department of Education, West Bengal State University, and all faculty members of Krishnath College and all the viewers who are enjoying on listening the webinar. We have to set our environment for combating this world. Friends, we don't know what is our expiry date, but we live, enjoy, make a relationship with each other. To relieve panic from death and disease, we have to do something, some measures, some health measures to increase our power of immunity, both in body and also in mind. Yesterday, at night, my daughter, she is now put in room. I miss my school, I miss my playground, and don't like this virtual classroom. My teenager son, she asked me when I'll go to school. A teenager boy asked me, Mom, I very much disturbed for the death of George Floyd, his death. He asked me, mentally, I am black skin. My skin is bad. I think I shall go to abroad for better learning for job. In this time, this is my dream. But how can it be possible if they think I am black and they make me a victim? I don't know the answer. This is our world. We make this. We don't know why some people is cruel, why some people kill, torture, we don't know. But we think they are sick because we make our world sick, because we think we cannot combat with only some diseases, but our mental sickness. For combating this situation, we can fight against the evil power. In this condition, Corona, give us some lesson how to restore our some feelings. They give us lesson to know ourselves. Please stay home and look in thyself. We know life is mortal, but we love to live. We have the first duty to love nature, restore our mind, to love mankind. We know our ancient people told, Pasho Devasya Kabbam, no Mamaro, no Jibjoti. Pasho Devasya Kabbam, no Mamaro, no Jibjoti. Our life is mortal. Our beautiful nature is waiting. They are not growing day to day. Decay will come, but we can restore our mind. We can we will be restore our health and mind and immunity system. Now I welcome Dr. Ranjan Bhattacharyya, and at first he will talk, and before that I will utter some words from Gitanjali by Rabindranath Tagore. In this situation, I utter these words. Thou hast made me endless, such is thy pleasure. This great vessel thou emptiest again and again, and fillest it ever with fresh light. This little fruit of a reed thou hast carried over hills and dales, and hast breathed thy melodies eternally new. At the immortal touch of thy hands, my little heart loses its limits in joy and gives birth to utterance ineffable. Thy infinite gifts come to me only on these very small hands of mine. Ages pass, and still thou pourest, and still there is room to fill. So friend, don't not only wash your hand, please wash your mind. Thank you everybody. Thank you everyone for listening us, and I welcome Dr. Bhattacharyya for giving us some suggestion how we can fight against COVID-19 and save our mind and save our world. Thank you.
Thank you, Sujata Madam, for your kind and generous words. I think I am audible and visible, am I?
Yes, sir. Yes, sir.
Okay, thank you very much. So at the outset, I would like to I would like to express my sincere gratitude and express my thanks to none other than Principal of the Krishnath College, Professor Dr. Sujata Bagchi.
Excuse me. Excuse me, sir.
Yes.
Sir, before you start, I just want
Sure,
to say
please,
some
please.
words.
Sure, sure. Go ahead.
First of all, thank you, madam, for your welcome speech. A very good afternoon to all of you. Respected Principal, madam, Dr. Sujata Bagchi Banerjee, madam, honorable speakers, dear participants on our YouTube live channel today, ladies and gentlemen. I am Dr. Sandeep More, Assistant Professor of Botany, Krishnath College. It gives me immense pleasure to extend to you a very warm welcome.
Camera
Our-
position. Camera position.
Huh?
ক্যামেরা পজিশনটা একটু ঠিক করে রাখুন।
A very warm welcome to our first national webinar on restoration of mental health and hygiene in the COVID-19 affected world. I feel very privileged and honored to introduce our speakers today, that is Dr. Ranjan Bhattacharyya and Dr. Shnaoli Chakraborty Acharya. The first lecture would be delivered by Dr. Bhattacharyya. Dr. Bhattacharya got his MBBS degree from Calcutta Medical College and did his MD in Psychiatry from the Institute of Postgraduate Medical Education and Research, that is IPGMER, Kolkata, and also did a DNB in Psychiatry from the National Board of Examinations, New Delhi. Dr. Bhattacharya is a consultant neuropsychiatrist having experience over a decade. He is currently associated with Remedy Polyclinic Kolkata, Ranibagan Medical Center Bahrampur, Sonoscan Clinic Malda, Chikitsa Clinic Baruipur, and Doctors Clinic Bagbazar Hugli. He is also working as an associated professor and HOD in the Department of Psychiatry, Murshidabad Medical College and Hospital. He has specialized advanced training in epilepsy management, bipolar disorder, and drug de-addiction from the American Academy of Neurology, Johns Hopkins University, and NIMHANS, Bangalore, respectively. Dr. Bhattacharya has published several research articles in indexed national and international journals. He has also participated in various international conferences in Tashkent, Seoul, and Bangkok. He is also a regular participant in radio and television programs related to mental health and psychiatry. So, it is our great honor that we have with us today Dr. Ranjan Bhattacharya. But before he starts, here I would like to mention that Dr. Bhattacharya would deliver his speech for approximately half an hour. So this is to inform to all the participants that if you have any question, then you can ask your question on YouTube live chat box with your name and designation. After the talk ends, we would select few of your questions and discuss with Dr. Bhattacharya. Now, I request Dr. Bhattacharya to come to the web desk and deliver his lecture. Thank you, sir.
Thank you very much, Dr. Sandeep More, for your kind and generous introduction. Thank you, Professor Dr. Sujata Bagchi Banerjee, Madam, Principal KN College, Murshidabad, Bahrampur, Murshidabad. Thank you to my co-resource person, Dr. Shnaoli Chakraborty Acharya, Organizing Secretaries, Dr. Rajib Mukherjee, Dr. Pranab Kumar Halder, conveners, Dr. Niti Mollak, Dr. Debabrata Barmon, Dr. Sandeep More, and the members of the organizing committee, Sri Biplab Bandyopadhyay, Dr. Barnali Mukherjee, Dr. Dola Boral, Dr. Krishnath Munsi, and not less to mention about the technical support of Mr. Shujan Shah. So today I'm going to deliver a lecture on the COVID pandemic and its aftermath and mental health issue. When I became to choose the psychiatrist, there will be lots of stigma had been associated with the subject psychiatry, and you will be know that people think that these patients that I deal are mostly fanatic, and the doctors who treat them are also some way, somewhere have showing eccentric and odd behavior. But I can recall during my childhood days when I used to, there is, if you have seen that we are now re-watching the epics like Ramayana and Mahabharata. During our childhood days, one of the important ad tagline used to visible in the various series of the SAIL, the Steel Authority of India Limited. The catchline of that was, there is little bit of steel in your everybody's life. You will find from jeep to aeroplane to missile, the presence of the steel. So I'd like to reframe that phrase, there is little bit of psychiatry in everybody's life. From womb to tomb, across all ages, in both sexes, you're bound to suffer from some sort of psychiatric problems and mental health issues. So COVID epidemic and its aftermath is no way immune to that. I think I'm able to share the screen. Are you able to see it? Can anybody confirm that you are able to see the screen right now?
Okay, sir.
Is it
Yes,
fine?
you please continue.
Thank you so
Please
much.
continue, sir.
Thank you so much. So, as you know, the COVID pandemic, it has been started perhaps in the middle of the November 2019, when there are certain cases of the atypical pneumonia in China, but it has not been disclosed. So later, it has been first recollected by a group of series of works, and that has been shown by one of the leading ophthalmologists. His name is Dr. Li Wenliang, who is a Chinese ophthalmologist working in the Wuhan Central Hospital. He found that there are some atypical cases of pneumonia occurring who have consumed some fish items from the seafood market of the Hubei province of the Wuhan. And it has been found that these people are suffering, but his discovery has been suppressed. And later, on 30th December, the Center for Disease Control issued multiple emergency warning to the local hospital that some atypical pneumonia cases are emerging. On the last day of the last year, that is on the 31st December, when the entire world is celebrating the New Year Eve, perhaps the first case has been officially disclosed by the government Republic of the China that an epidemic, a pandemic of the disease has occurred. But at that point of time, people are not very much not very much accepted to this claim, and they have not they have lots of researches and speculations are going on, and there are political lobbyings also going on. On 23rd of the January, it has been in a meeting of the executive committee of the World Health Organization, it has been found to be a serious concern, but it had only been disclosed officially that this COVID-19 has become the public health emergency of international concern, or what is known as PHEIC, on 30th January only. 30th January is a remarkable day because on that day, 3 cases of the COVID-19 positive cases has been officially diagnosed in India. Three people residing in the Kerala who has a travel history has been first diagnosed to have COVID-19. So you can see in the display, we cannot read it. I think any of the students or whoever is watching this webinar, if he or she knows the Chinese language, could recall, but this language is very it's out of world experience to all of us who have not learned the Chinese language. So till date, the COVID-19, the many facets are remain unknown to all of us, like this Chinese language. So the rest in peace, Dr. Li Wenliang. If usually we do not start any presentation with an obituary, but I would like to present this one because he was the first young ophthalmologist who said this strange. He was the change setter and first show the alarm to all the world that some emergency cases, some atypical pneumonia cases has been there, but he has to suffer lots of humiliation, lots of police action, and in fact he contracted COVID-19 and died on the month of the February only at the age of 33. His parents has also been found to be COVID positive, but later recovered. So the death of the Li Wenliang, the Chinese ophthalmologist, was very, very important to physicians like us, because he was the change setter and he's a whistleblower who first described this and bring these episodes of atypical pneumonia cases caused by the SARS-CoV-2. 59 suspected cases with certain atypical symptoms like fever, dry cough were transferred to a designated hospital in the Wuhan, China, and 41 of them has been diagnosed as to suffer from COVID-19. This is the first official publication in Lancet, 24 January. This survey has been conducted starting from the 31st of the December, ending in the 20th January, and ultimately published in the 24th January, that these patients, and most of these patients, if you can go through these histograms, you will find that most of these patients were from this seafood market of the Wuhan. So the entire thing goes like this. The incubation period of this SARS-CoV-2 illness is 2 to 16 days. Incubation period is the entry of the agent in your body and development of the first sign of symptoms. So development of first sign of symptom entries or incubation period. People will remain asymptomatic for initial 6 to 7 days. The first sign will probably appear on the 7th day. On 8 and 9 days, the symptom will worsen. Remember that 81% of the people who will be contacted with the COVID-19 will remain asymptomatic. But the 19% who will become symptomatic, his or her symptom will progress very rapidly. On 8th day admission, 9 day shifting to requiring the ICU support. On 10th and 11th day, probably the ventilator support will be required. So the mortality rate is low, 2 to 3% across world, but the infectivity rate is very, very high. So this is the seminal paper which has been published in the Lancet about this illness, and the first official data published, and entire world is aware. But you can recall, even on the 30th January, the WHO described it as a public health emergency, but it took almost more than 1.5 months thereafter. Only on the 11th March 2020, the WHO officially declared it as a global pandemic. You can see you need not to be a technical person or a doctor. On the first initial X-ray, that picture is very clear on the left-hand side. On the right-hand side, on the later phases, within 3 to 4 days, there are changes in the chest X-ray. Even in the CT scan on the left-hand corner, if we go clockwise from the left upper corner to downwards, you will see the progression of the involvement of the pneumonia. It doesn't require to have a specialized, even in a person who is not specialist, he or she can watch this progression. So there are symptoms, and as you can see, as I mentioned, the signs and symptoms are very, very common, and the most important 3 common symptoms probably is the dry cough, which is very common, and also the fever and respiratory distress. These 3 common symptoms are often present in this group of atypical pneumonia. And as you know, the coronavirus is known to be there in the environment for over years. Over more than 200 strains of the coronavirus are there, but among these, only 7 can infect human. The 7th strain is being the SARS-CoV-2. We had the certain health emergencies also in the 2002, which was known as the SARS infection, the severe acute respiratory syndrome, which has infected almost 2,000 people. And in the 2012, we had a similar episode of MERS, the Middle East Respiratory Syndrome. It requires some vector, it's a vector-borne disease. The vector for the SARS infection in the 2002 was the bat, and in the 2012, it was the camel, because it infected the Middle East countries. And I can see the changes. It's a global update. The global calculator is going every day and it's changing. And India is ranking higher and higher. India today ranked all over the world on the 7th position. And total deaths have already occurred, almost 6,312. And we can see the new cases and new deaths occurring on even yesterday. The statistics of yesterday that I have collected from this global on the official website of the mygov.in COVID-19 and Ministry of Health and Family Welfare, that yesterday 7,900, almost 8,000 cases, new cases were there, of which 224 new deaths occurred in India. So there are phylogenetic analysis. The expert estimated that it has started 22nd to 24th November. It goes back in China. And in the South China morning, you can see the first infected person has been described. That is known as patient 0. The first hospital admission occurred in the 16th December, a patient with exposure of the human seafood market in the Wuhan. First public message in the pandemic was given on the New Year Eve day, that is the 31st December 2019. Public health emergency consent, and followed by pandemic on 11th March. Now, some term that outbreak, endemic, epidemic, and pandemic must be aligned to many of the participants. I would like to describe them in a nutshell. The outbreak is a sudden increase of occurrence of any disease. For example, outbreak of cholera can occur. Endemic is the constant maintained increase in occurrence of a disease in geographic area. Like malaria is endemic to this part of eastern part of the India. Epidemic is the rapid spread of disease to a large number of people in a certain time. And the pandemic, when it crosses the geographical boundary, all the countries of the world has been now affected with the COVID-19, irrespective of their caste, creed, religion. This pandemic has been spread at a very fast rate from one continent to other continent. Now, it's a very important slide that is very specific for a more specialized person, but I would like to say the immunity, the antigen and antibody part. There is a window period when when this virus will enter in your body, you will remain asymptomatic for, as I mentioned, for initial 6 to 8 days. In fact, 81% will remain asymptomatic. Then the first of symptom will begin, and when the first symptom will begin, the IgM antibody is the first soldier which will appear in our blood. The IgM will become appear, and after certain days the antibody IgG will come, and thereafter IgM will disappear, and IgG, the immunoglobulin G, when it will be present, it will remain lifelong. So antigen detection and antibody detection is the cornerstone of diagnosis. Antigen can be detected by PCR technique, also polymerase chain reaction. There's a real-time polymerase chain reaction. We have now machines in the virology department and virology research diagnostic laboratory. VRDL laboratory setup is there. We are collecting the swabs from oropharynx and from nasopharynx or for saliva. We are keeping this with the sample. We are transporting to our microbiology laboratory by media known as viral transport media, and then we are examining with this RT-PCR technique. And RT-PCR technique has been one of the scientific method and proven technique, but it can be, there could be false negative cases because it can diagnose almost 71 to 72% cases. The remaining 28% will remain undiagnosed. And for the country like us, we often use the pool test setting. Pool test setting can diagnose at a time five persons. We just do the pool antibody test, and if the test remains negative, then that 5% will be considered to be negative. Now, active case finding is very, very important. Patients and their visitor will visit the healthcare facilities, and the healthcare providers who cared for or cleaned the room of an infected patient, where the infectious control protocol has to be followed in a very stringent manner, and social, familial, and work contacts of the infected patient has to be found out. So case finding is one of the important cornerstone of the epidemiology to prevent the community transmission. Community transmission once occur, it will remain, it will go beyond our height. So stage 3 is the stage for the community transmission, and we have to go for the contact tracing, identifying the contact from the infected patients, noting their name, contact, demographic location, first and last exposure. We put them in isolation, and isolation should go for the 14 days. You can know the quarantine period. Quarantine can be occurred in the home setup or in the hospital setup or institutional setup. So depending on that, we are just preventing the community transmission. Now, if we go through search the coronavirus in the Google and press enter, you will find the lots of results. But these days, the government has stringent regulation that no ads, no product recommendation, no links to website will be figured out. So initially there had been lots of speculation, and one of the important thing is that the Silicon Valley responded to a terminology which is known as infodemic, information bombardment. With these informations are being spread in a faster rate, many rumors without verification of the source. We are just getting a tsunami of the flooded informations are there. So it's a big question whether COVID-19 is a pandemic or infodemic. We have to unmask the truth of this. 100 dies in the Iran over the false belief. There is an instance of the alcoholic poisoning in Iran, which skyrocketed amid the coronavirus pandemic. There is a speculation was going on that in the Iran, ethyl alcohol is banned. So people thought that the methyl alcohol, if they use the methyl alcohol with adding some honey, it will just cure their, or it will protect them from COVID-19 without any scientific verification. More than 728 people have died from ingesting toxic methanol alcohol since February 20. There are myth booster. Lots of fake news are going. Italy surrender, very motivational from the GRD data. 3 arrested for even the lots of people are being arrested for spreading the fake news. And cybercrime law is very stringent for them. So myth boosters has to be opened up because there are many speculations of infodemic, that is an overabundance of information, and many of them are inaccurate, harmful, and people do believe them instantaneously, and there is an impulsivity that they will share this information, and this has created the WHO to form certain rules and regulation. The various regions of the WHO, that is Western Pacific region, the Southeast Asian region, the region of the America, European region, Eastern Mediterranean region, and Africa, they have gone for a stringent actions for spreading this false information or infodemic. Sundar Pichai, that CEO of the Google, has also told that we want to help the business and schools impacted by the COVID-19, and we'll give the free access to our advanced meet and video conferencing. So various peoples are coming forward, but we should not use this as a platform of misinformations through internet, and which is a very strong influence media in these days. There are various facts and myths are there that adding pepper to your soup or other meals will prevent COVID-19. There is no scientific basis that adding pepper in the soup will help one out. There are also myths that currently there are certain drugs that there are, people are taking these drugs without consultation of any doctors. Many of them have consumed hydroxychloroquine and azithromycin tablet over the counter. Even the president of US also called for the hydroxychloroquine tablet. One of the papers in the Lancet has there is overview that it is not helpful, but ICMR, Indian Council of Medical Research, has found hydroxychloroquine to be very effective as a prophylaxis healthcare worker. So hydroxychloroquine has serious side effects without doing a ECG to especially the elder people. If you just give the hydroxychloroquine, there's a chance of ventricular arrhythmia. So these myths often causes dangers to certain people who consumes these tablets fanatically without consultation with a specialist. The spraying introducing bleach solution will not protect you against the COVID-19. If you can bleach yourself with the disinfectant in your spreading your body, the bleach and disinfectant should be used very carefully, because the chlorine bleach, the sodium hypochlorite, and other disinfectant should be kept out of reach from the children. Drinking ethanol bleach does not prevent or cure COVID-19. I have just mentioned about the Iran tragedy where the many people have consumed methyl alcohol, and even there is an incident that the methyl alcohol bandage was put in a neonate, and which has resulted in blindness of that neonate just to protect that kid from the COVID-19. There are being other facts and myths that best way to confirm if you have the virus producing COVID-19 is a laboratory test. Not holding your breath for 10 seconds will realize you that you have a very good amount of the functional vital capacity of your lung and you are immune to the COVID-19. This is also a myth. There is no fact of that. COVID-19 can be transmitted in areas with a hot and humid climate. We have a erroneous belief that India being the hot and humid climate, and we have entered the month of May, it will be the very hot season and will be immune to COVID-19, and people will not wear masks, will not keep the physical distancing for 1 meter as mentioned by the WHO, and 2 meters as mentioned by the Center for Disease Control of Atlanta. If we do not practice this sort of exercises, the hot and humid weather is no way immune to the COVID-19. The new coronavirus cannot be transmitted through the mosquito bite people pick up. Initially, there was a speculation going through the social medias that if there is a person remaining in the hospital quarantine, or if the person has been diagnosed with COVID-19 and keeping themselves in isolation from one person to one person, another person, it will be spread by a mosquito bite. There is no such scientific basis. Even the ultraviolet lamps should not is not immune. Rather, UV radiation can cause serious skin damage and skin irritation to your eye, and it's also carcinogenic. Certain cancers like basal cell carcinoma the incidence of basal cell carcinoma can be raised with the use of the indiscriminate use of the ultraviolet rays. The vaccine is no vaccine is there to prevent the pneumonia. There are certain other bacterial pneumonia vaccines are available in the market, but this is caused by the virus. So, and vaccines are on trial, but I think the vaccine will hit the market only after a proper research. It will require the randomized double-blind placebo-controlled trial, and it will require the phase 3 human trial followed by phase 4 post-marketing trial. Then the vaccine will appear in our market, but it is cumbersome. It will take some time. Only precaution we should practice is the hand washing, physical distancing, cough etiquette, and wearing the mask. The eating garlic will help to prevent the infection. Again, there is no such evidence on the current outbreak that eating garlic has protected people from new coronavirus. Rather, it will generate foul smelling in your mouth and your close one will feel offended. Does the new coronavirus affect older people or younger people are also susceptible? The older people has more comorbidities. As you know, the person who having the comorbidities in the form of diabetes, hypertension, bronchial asthma are more having risk of serious adverse consequences. Younger people are to some extent immune because the immune system has not been developed properly. But the kids has higher risk because they can act as a carrier, and if they go to the senior citizens of the household, like the grandparents or any other person who is aged more than 60 years, it will carry that asymptomatic carrier, can infect the senior citizens. Now, hand washing technique has to be practiced in a proper way. We do not do that. Hand washing means washing the hand from the wrist joint to the tip of the finger to the nail beds, and it should be practiced as per the WHO guideline for the 40 seconds. At least 20 seconds should be given dedicated way for proper hand washing, and it should be done on an hourly basis or as and when required. To memorize, you can just sing in yourself that happy birthday to you, happy birthday to you, happy birthday to dash, happy birthday to you, or twinkle twinkle little star rhyme. So the time is taken to just utter these rhymes will be appropriate time required for hand washing. Now, combating infodemic, we have to join hands. WHO's new launch platform was there by John Jakartas. Immediately after COVID-19 as declared as public health emergency, WHO set a network which is known as the WHO Information Network, or WIN for epidemics, which is abbreviated as AP-WIN. The Sylvie Brand, the director of the infectious disease management of the WHO, he told that we know that every outbreak will be accompanied by a kind of tsunami of information, misinformation, rumors. And the media manager of the WHO, Dr. Kuzmanovic, told to the Lancet, the remarkable international pioneer journal, that the fighting infodemics and misinformation is a joint effort including the Facebook, Twitter, Tencent, Pinterest, TikTok, and various popular social medias. Google, Kuzmanovic noted that has created an SOS alert on the COVID-19 for the 6 official UN languages, and Dr. Tedros informed that WHO also uses social media for real-time updates. WHO is also working with the other voluntary organizations like the UNICEF and the Red Cross Society, International Federation of the Red Cross and Red Crescent Societies, for this joint effort to reduce the infodemic following the COVID-19. WHO statement, the official statement given by the Director General Tedros Adhanom Ghebreyesus at the Munich Security Conference on 15 February, that we are not just fighting an epidemic, we are also fighting an infodemic. And WAP-WIN was launched for this, and the goal was to share or customize information with specific target group. The false information has intent or knowledge. The intent can be misinformation or disinformation, and knowledge can be opinion-based and fact-based. So the restrictions are there. There are search engines has been reformulated in such a manner that this infodemic is reduced and false informations are not being shared to create panic state. Social media informatic, the example how it has affected, the CNN has recently anticipated rumor that possible lockdown of the northern Italy to prevent the pandemics, publishing the news for the official communication, what it has created. The people overcrowded the trains from the northern part of the Italy, and they're moving to the southern part. And another example of this, improper health communication has related the same kind of thing in the Nigeria. Even in India, father of the three was reported to commit suicide, though it was under investigation what is the actual cause of suicide. On hearing the diagnosis, intervention to address this misinformation and rumors, that with the frontline healthcare provider should be equipped with the most recent research findings and accurate information, because they are already in a very strenuous conditions. So anything being shared with the powerful social media has to be validated, has to be searched for the authenticity. Mass media, community organizations, support groups, and civic society may play a very, very important role. And it's necessary to build a strategic partnership at a local level, regional level, national level, as well as the global level, and so that we can join hands together to prevent the false information sharing and communication across various platforms. All hoaxes and rumors should be removed from all online platforms. Only scientifically sound, validated information should go to the mass people. And online portals and personnel involved with the production and propagation of such misinformation should be brought under the justice, under the stringent punishment of the law. So in a nutshell, think twice and act twice. Consider the source, read beyond it, check the author, support the sources, check the date. Is it a joke or not? Check your biases and ask the experts before sharing. We are very, very fond to copy, paste, and share, but just do that after only validation. So coming to the our part, the psychiatrist, as I mentioned in our early days, it was very stigmatizing to become a psychiatrist. When I got the PG, I was very much reluctant to take the subject, and I was thinking what the people will react, what my relatives will share. But I think that 1 in 3% in the world is suffering from depression, and the prevalence of the psychiatric illness or mental health disorders are always in rise. So psychiatrist's role to counsel those hit by the lockdown was there initially in the paper. The role of psychiatrists are various fold. We are running the routine outpatient department and inpatient care. We have to train our fellow colleagues and nursing staff for the psychiatric first aid, PFA. PFA or psychiatric first aid to person in the quarantine center. Our team is visiting on a regular basis to the quarantine center, institutional quarantine center, and seeing the COVID positive cases wearing proper personal protective equipments. It is also important to give the PFA to the family members and relatives. Managing the primary psychiatric disorder like depression, bipolar disorder, or substance abuse like alcohol abuse, nicotine dependence, cannabis abuse, managing the psychiatric illness, managing relapses, monitoring the side effects of the drug, adverse drug reaction, and the treatment emergent adverse event. And we are now in an era of the teleconsultation. The telemedicine guideline has been approved. It was there in the first. The draft has been created in the 25th March of 2020, and now it has been legalized on the 12th May, gazetted on 12th May 2020. Psychiatric first aid was first, the terminology was called by the Sphere and ISC, and also it is meant for the practical care and support, assessing needs and concern, helping people address the basic needs, listening to people, but not pressuring them to talk, or comforting people and helping them to feel calm, and protecting people from further damage. So mental health reminders are basically we have to be properly dressed, because we have to remind that this is not going to end. The COVID-19 is not going to end sooner. So you should not stop your relaxation, your day-to-day activities, but you have to do the basic precautionary measures. Get dressed, eat, be creative. It is an ample time, golden opportunity to become creative. In fact, during this time, we from our department are doing 10 scientific research, and the research activities are going there. We are staying connected with each other. Do your hair and hairstyle and makeup. Get some fresh air. Unplug yourself. All time looking the television channels and watching the news channel. The prevalence of COVID-19 is increasing, quote unquote. It's an alarming rate. It is spreading in a faster rates, with seeing some sorrowful picture that people are not getting enough space to be getting buried or reach out. The mental health is also important for going to the underprivileged sector, because the people who are privileged can enjoy the lockdown for 60 days, but underprivileged people who are daily bread runner are not getting their food or their shelters, and they are in a sorrow state of affair. Now going to some positive news. All things are not being stopped. The new baby has born during the COVID-19 pandemic in our hospital. We are doing some activities in our place. So people who are migrant laborer coming with a huge number in a train, we are doing their regular checkup, wearing the PP. We are from our department, we are creating awareness among the doctors, nursing staffs, or the healthcare providers who are wearing the first line warriors. This is the first picture in before the setup of the COVID hospital in our place. So we are just preparing for the COVID hospital. It is now operationally running fully. This is one of the patient who has developed the severe acute respiratory illness, and we have survived him. This is one of the paper that has been published. Probably this is the first paper following the COVID-19 on the mental health aspect, published by myself and my colleague Shekhar Chatterjee, about the attitude, practice, behavior, and mental health impact of COVID-19 on doctors. We have surveyed 152 doctors in online Google platform and asked several questionnaires, and they have responded well. It has the salient feature of this is that the 87% of the doctors are feeling proud to act as a COVID warrior. But many people are getting socially ostracized. They are not being welcome in their flat complex, in their household complex, or by their neighbors. So many people are getting something apprehensive to work on because of lack of certain protective measures like personal protective equipments. Only 12% of people had this provision to get the PP during our survey. The things has improved drastically right now. We have ample stores of the personal protective equipment, gloves, N95 masks right now. And one important key finding has emerged that 44% of the doctors who are working as a frontline warriors has some comorbidities in the form of diabetes, hypertension, or COPD. So coming to the stress factor, stress is going on everywhere. The stress is required. If you go to the lower curve, it is known as this curve. The curve is known as Yerkes-Dodson law. Initially, in the x-axis, this arousal, and y-axis is the performance. So initial little bit of stress is very helpful. So initial stress will build up the performance, but after a certain time, it is known as break-even point. In the management, we know as when the marginal cost is equal to the operational cost. So after this point, if there is a arousal or stress is ongoing, the performance is bound to be the negative stress. So eustress is the break-even point, the optimum level, a positive form of stress that helps us to perform and is usually experienced when we are going through the happy events. And negative events or negative emotion can generate the negative stress in the form of distress. This is one of the types of the stress that mind and body undergo in the normal routine is constantly adjusted and altered. Hypostress is a lack of stress, working in an understimulating environment, and hyperstress is the type of the negative state that comes when a person is forced to undergo more than he or she can take the job or responsibilities. Now, one episode of our frontline workers, two doctors went to go for the household survey, Dr. Trupti and Dr. Jakia, on the 31st March, but they had been given a very strong setback by some localites in Indore, and they have been pelted and stones are thrown to them, but they have not stopped. They again go to the same place on the 1st April after 24 hours, and they have been welcomed by the local residents. So we shouldn't stop with certain inhibition. We have to go ahead with our job. The lockdown impact is very evident. There are various theories where there are 21 days lockdown, 28 days following the 5 days intervening period, 3 subsequent hard lockdowns with the 21, 28 to 18 days model with 5 intervening periods. So after this lockdown period, the lockdown is not going to eradicate the COVID-19 from the environment. Lockdown is just to give the enough time. We are buying some time to just make our setups ready. We have now made the COVID hospital ready. We are going for the research work for innovation in the form of the vaccinations. With the healthcare staffs are now ready. India has the privilege that we have been affected at last point of the COVID-19. So we have resources. We are ready now. We are ready to fight the COVID-19 in the strongest possible manner. Now, there are very funny things are going around. People are wearing masks in a ridiculous manner. They are not covering their nose. They are often covering their mouth, or it seems to be hanging from in their chins. We are touching the mask very frequently. Do not touch the external surface of the mask. Once you are touching the mask, so it is getting contaminated, and it is of no use. So wash hand with alcohol-based hand rub, at least 70% alcohol-based hand rub, or the soap and water. Remove the mask, remove it from whenever you're trying to remove it from behind, not touching the front part. Discard immediately in a closed bin, clean hands with an alcohol-based hand soap and water solution. The communication with the patients is extremely important. Even every day I am opening the newspaper. In fact, I have to give many comments in various newspapers that people are getting marginalized, ostracized, and people are not at all welcome. Whenever a person is diagnosed to have COVID positive, he or she or their family members are being ostracized and being very, very much stigmatized in our society. My message: be respectful, polite, and empathic. Be aware that suspected and confirmed cases and any visitors accompanying them may be stressed or afraid. Even I have seen that name of the people who are affected and their geographical location has been forwarded in the social medias. The most important thing you can do is to listen carefully to the questions, answer any question, and provide correct information of the COVID-19. So there are three stages: the stage of fear, stage of learning, and stage of growth. We are initially in the stage of fear. Whenever we have heard that we have to go for the Janta curfew, then for 14 hours, followed by a lockdown of 21 days, people rush to the shopping places to buy and purchase food, going to the market paper and fanatically bought the toilet paper, the hand sanitizer. This is the stage of fear. Then we have gone to the stage of learning, identifying the feelings, emotion. We cannot control everything. You shouldn't watch the television news channel throughout the day. And now the stage of the growth. We think that we are trying to help others, donating generously, going to the underprivileged sector, and this is the probably together we can win this situation. Now coming to the healthcare facility staff, it is very normal. All of us took very normal to become sad, stressed, or overwhelmed during this crisis. Talk to people who trust or counseling. Counseling, the listening skill is extremely important. We are all very brilliant speakers, but very few of our very good listeners. We have to be very good listener. Don't use alcohol, smoking, or other unhelpful coping strategy during this period. If you have the concern, talk with your supervisor, and if you start feeling unwell, tell your doctor immediately. Good amount of food is extremely important. Eat right things, simple and nutritious food. Stay hydrated. You may forget to drink sufficient water. Most of the time we are wearing PPE for long hours and we feel dehydrated during these places because most of the wards are not air conditioned. We have to wear this PPE for long hours. It is extremely important to stay hydrated because during the wearing period of the PPE, we are not entitled to take food or drinks. Stay active without a proper structure to your day. Avoid falling into trap of becoming lazy or laid back. Sleep well. Good amount of sleep for 6 to 8 hours is extremely important. Most of the youngsters who are watching this webinar, they have the habit of delayed sleep phase. That is, they are sleeping late at night, 1 o'clock, 2 o'clock, and waking up at the late morning, 9 o'clock, 10 o'clock. It is not going to help. Our body goes through a circadian rhythm. Circadian rhythm is governed by the pineal gland. So it is extremely important to sleep at the right time by 10 to 11 o'clock in the night, and you have to wake up by 6 to 7 o'clock in the morning. And good 6 to 8 hours sleep is at least required. Nurture your relationship is perhaps the time to call back your school friends, old friends, your parents, your distant relative whom you are not connected for a long time. Connect with the friends, families, and experience the joy of giving. Joy of giving is much pleasurable of joy of getting. And take charges for the psychological well-being, the physical, psychological, and the physical and psychological well-being is extremely important for all of us. Now, the mental health and psychological consideration during COVID-19, this is our last 2 or 3 slides I'm going through. People who are affected have not done anything wrong. They are same human being like all of us. Do not refer to people that with COVID-19 cases, it is very, very stigmatizing, or to call the family members of the victim as COVID-19 families. Rather, reframe people who have COVID-19, people who have recovered from the COVID-19. We're seeing the statistics that this amount have been affected, this amount of people have died, but this is always cumulating. So cumulating number of people will get affected will also always rising. Minimize watching, reading, or listening the news about COVID-19 throughout the day. And one of the members should watch, one of the senior member of the family should watch and discuss the news to other members. It's not a good thing to watch by all the members of the family to the news channels and getting their various viewpoints. It will just generate confusion. Share stories of people who have recovered or who have supported a loved one, honor carers and healthcare workers. Now, newest thing is the telemedicine practice guideline. So during this part, the people are not getting doctors. The doctors are not available. Doctors are seeing patient in a less number. People are becoming afraid to visit the consultation. So Board of Governors, in supersession of the Medical Council of India, in association with the Niti Aayog, the central government has projected the telemedicine practice guideline. And by virtue of doing this is now legal framework. So we can use various platforms like video, the telemedicine chat, by various social medias, the video chat is allowed, audio chat by phone or various voice applications, or the text-based message in the various social media, or even the ordinary text-based messages are helpful. There are various strengths and weaknesses of various messages, but certain medications are prohibited to be used by the video mode of consultation. But the novel thing is that this video consultation or telemedicine consultation probably down the line after say 5 or 10 years, what impact the COVID pandemic, probably one of the good thing that COVID pandemic has done to us is that we have learned that we have to face these things. We have learned that we can live our life with minimum requirement. Many things are not required. They are absolutely wastage, and we can use the video mode of consultation. So no point of wasting so many time to travel to a doctor's clinic or a hospital and waiting for a long period. So it's available by you to smartphone app. You can consult your doctors and law is there. So my take-home messages are very simple. It's only a tough time that brings our true self inside. A lot of uncertainty prevailing us. It's not only the coronavirus that is highly contagious, our social ostracization and the infodemic is also, information epidemic is also very, very contagious with misinformation, fear, threat, and worst appreciation of the people. Stop doubt, pessimism, no negative thinking, think always in a positive manner. Stop cynicism, shaming, fault finding, and blaming others. Rise above the religious, national, geopolitical, and social level. Try to be a role model for everyone else in your vicinity and accept more, discriminate less. So in A to Z, the coronavirus infection, the avoid crowd, beware of fake news, clean your hand, don't go out, empathy, the listening skill, gathering is bad, so on and so forth. So stay away from the fake news is my take-home message to all of the youngsters. I've been hearing so many conflicting news and theories of COVID-19 that I think I am developing a herd immunity. At the look, the spelling of the herd, listening immunity. Actually, herd immunity is the spelling is HERD. Herd is the when certain amount of people will get infected, it will the immunity will pass to other persons in the community, so they will get protected. But I have hearing so much false news. I have developed the herd immunity. So thank you very much. I have the privilege to take the photograph of that gentleman whose 3-letter, 1 digit and 1 symbol has revolutionized the concept of science. Thank you for your patient sharing. I think I have finished in due time. Over to you, Sandeep sir.
Hello, am I audible?
Yes, yes.
Thank you so much, Dr. Bhattacharya, for giving your valuable insights on mental health and hygiene. And I am sure that your address will put forward to get some remedies to combat this COVID-19 pandemic. So, well, now I can, dozens of questions are coming and we are getting the questions on YouTube live channel. But due to shortage of time, we would not be able to answer all the questions. But definitely we would select some questions from them and we'll discuss with Dr. Bhattacharya. So, Dr. Bhattacharya, can you listen to me?
Yes. Yes, sir. Please go ahead.
So, sir, actually, there are multiple questions coming. People are very much curious. But first question is, actually, there are many questions, but 2 questions are very much related. So I will ask you both the questions and then you can give your answer.
Sure.
First question is from Gaji Mondol, guest of Krishnath College. He is asking, that how can I know that my student mental health is affected by this corona pandemic, and what can I do to for him to overcome that? So this is a question from a student, from a teacher,
Yes, sir.
and
Yes, sir. Shall I
another
respond to this question?
before you respond, I want to ask you the same type of question that it is from Parijat Choudhury from Vishwabharati University, asking that as a trainee teacher, how can I tackle students' mental health in this time, and how can I support them physically and mentally during this depressing lockdown time?
Thank you
Over
very
to you,
much
sir.
for these wonderful questions. Echo is going. Okay. Thank you for the question asked by the Gaji sir, and also the Vishwavarti teacher, guest teacher sir, the Parijat sir. So both the questions are quite linked at how to diagnose the patients having mental health issues and what will be the treatment in a nutshell from a clinician perspective of view. So as you know, the psychological impact will come later half. Initially, the pandemic will spread on. We'll be much concerned about get the infectivity rate, the death rate, but this will generate lots of psychological problems. For example, there will be depression, the people will feel sad, people in the lockdown phase staying in the home for a longer time cannot mix with the near dear ones, that the fellow students, fellow friends are not available in direct consult, direct meeting, so cannot attend the classes. All the recreations has been stopped, cannot go to the restaurant, cannot go to the movie to watch the movie, we cannot go to the markets. So these are the various stressful events, and stressful events are not being expressed reasonably, as mentioned by both the teachers rightly, that the people will not come. We are not living in the United States that people students will come that, sir, I am feeling depressed, take me for a consultation to a psychiatrist. People, your students will give some behavioral symptoms. Behavioral symptoms will that, number one, they will seem very much sad, not attentive in the class, or not mixing with the people, staying in home for prolonged hours, getting irritable on trivial issues. These are very key important signs. The sudden fearfulness, anxiety, panicky situation will come. The panic symptom will be present with some bodily symptoms. The students will come to you and will tell that, sir, I am having palpitation, I am having breathing difficulty, and both the breathing difficulty is very one of the key symptoms of the COVID-19. So people will think that I have been affected and I'm having the breathing difficulty, and will try to hold his or her breath for 10 seconds, as mentioned in one of the meets. Then many during this lockdown period, the people are economically also getting deprived. Most of the parents are not so much privileged to earn a lot of money, because they have to give the they are also under certain prohibitions and crippled by economic disadvantages. Many people will go to the unhelpful coping strategies, and many people had shown, some of the people had shown, they have some psychotic behavior. Psychotic behavior means they are getting afraid, there are sleepless night, and had been some episodes of runaway from the home has been encountered. So being a teacher, your job, sir, to look after which students can cope up with this. Coping is an important mechanism from which we revive from the drawback situations, or from back foot will come to the forefront. It's being a teacher, you have to become always positive. It's not about your what you speak or your verbal language is important. Your body language has to be very positive, because you are a role model to all of the teachers. Even I know that I have the same chance of getting affected. I am putting myself and my family is at risk. But if I drop my shoulders down, what message will it carry to the larger community? So be positive. The COVID-19, like all other infections, has created a havoc to all of us. We are suffering a bit, but we know that at the end of the tunnel, there will be light, and we'll definitely together win these adverse situations. Thank you.
Sir, the next question is from Shravani Pal. Hello.
Yes, sir. Go ahead.
The next question is from Saboni Pal. She is asking that already mentioned about hard immunity, but sir, she wants to know that what exactly is hard immunity, and is it practically possible in Indian subcontinent?
Yes, thank you very much. Let me explain the herd immunity first. Herd, for example, if there is an epidemic or endemic, as I mentioned, endemic as an endemic is there when it involves certain geographical region. For example, endemic has happened in a certain district of West Bengal. But epidemic is then sudden increase of number which is not akin to the geographic. Some foreign disease has been intruded in our locality, and pandemic is the geographical boundary has been crossed. So herd immunity, some people if get infected, they will develop antibody. So infection is the antigen is causing the infection. It could be bacterial, it could be viral, it could it's a foreign body. So we have our body system is fighting against the antigen and generating antibody. So this generation of antibody will pass from one person to another person. So if in a community 50% develop the antibody, that it is believed that rest 50% will get that herd immunity. Very simple example is that pulse polio immunization. You are seeing from lots of days that we are going to the pulse polio immunization. We are giving the vaccine, oral polio vaccine to the under 5 children, and giving that it is causing the herd immunity to the all the under 5 children in the locality. Similarly, we thought that the COVID-19 will also do the herd immunity, but unfortunately this COVID-19 has mutated itself in a strange manner. The COVID-19 in the Hubei provinces of the Wuhan district, it has lots of 25% antigenic change to the previous component. So this change is very, very important. And this change had happened with only a span of 8 years. In 2012, it was MERS, and 2019, it's a SARS-CoV-2. It's amazing. It is not possible to get the herd immunity so fast. We only can do simple things. Washing hands, regular basis, keep safe distancing, physical distancing for at least 1 meter, cough etiquette, it's a very, very important one. If the both persons are wearing mask, 85% of chances of infection getting reduced. If one person is not wearing mask, other person is wearing mask, the chance of infectivity is there as high as up to 70%. So wearing mask, physical distancing are extremely important, and do not hide your symptoms. Many people are thinking that we will be placed to the quarantine, will be sent to the 14 years Banvas like Lord Rama. That is not right thing. We have to go for only 14 days quarantine. Over to you. Over to you, sir.
Sir, next question is from Raju Maji. He is asking that is there any homeopathic medicine in combating COVID-19?
Okay. Ministry of Ayush has developed that there are some medicine. Echo is there. Oh, yes, thank you. So arsenicum has been claimed to have certain impact on the COVID-19 by Ministry of Ayush. As we know, the Ayush is an alternative system of medicine. It AYUSH, A for Ayurveda, Y for Yoga, U for Unani, S for Siddha, and H for homeopathy. So there was a claim that these medicines like arsenicum album will protect. But as you know, sir, we need to go for the randomized, double-blind, multicentric, placebo-controlled trial to get approved of any source of information. The science doesn't believe the claim. Science believe on evidence. So till date, I don't know, because I do practice in some other source of medicine, and I do not have any antipathy with the other system. I have a full respect with the other system of medicine. But till date, no medicines has been discovered to treat the COVID-19. The only medicine that COVID-19 can be treated is by personal protection. Be safe, be calm, don't panic, and maintain safe hygiene and safe hand washing practices, self-help practices. Thank you.
Sir, this is the last question, and this is from my side. I want to ask you that how we can see our country, our world after this corona pandemic era, and when?
Relevant, sir. What next? What next? The future. Where we'll go and where we'll go forward, and where this COVID pandemic end. So many researchers have claimed in many different ways we are living with quote unquote new normal strategy. So we have to accept that COVID-19 is there. We have to live with this COVID-19 for a long period, and we have to go for we have to reduce the pandemic to become an endemic first. We have to confine it to a specific geographical region, and it will take some time. Vaccine will take at least 18 months time to get approved by a trial. The various alternative medicines have been tried, some antiviral drug, including the antiretroviral drug, which have been commonly used for the HIV infection. Certain drugs, antiviral like remdesivir, oseltamivir has been tried. Hydroxychloroquine, which has been used for treatment of the malaria in this endemic zone, which is also act as an disease modifying anti-rheumatic drug, has been tried, but still date no definite drug therapy is available. We are looking, as we are getting new source of infection. India has done a remarkable thing. So people all over the world, the supreme power is looking for help from the India. India is the now becoming knowledge hub. We are controlling the Silicon Valley. Indian doctors are being acknowledged all over the world. Indian teachers, Indian brain has been appreciated all over the world. So we have done absolutely right thing, right strategies in right time. We have put the lockdown phenomena started from the 22nd March. We have started in very well behaved manner. We tried to stop the community spread. But a population of 137 crores people, it is very difficult to implement for a long period. So individual practices are very important. You, sir, you teachers will play a definitely very big role for the educational part. The health education is very much neglected. As I mentioned, people are not practicing the safe hygiene, safe methods. So complete safety restriction has to be implemented. And I think together we'll definitely win over this adverse situation. And I would like to just end up my presentation with the famous poem of the Rabindranath Tagore, like Sujata madam has recited, that চিত্ত যেথা ভয় শূন্য উচ্চ যেথা শির জ্ঞান যেথা মুক্ত যেথা গৃহের প্রাচীর আপন প্রাঙ্গণ তলে দিবস সর্বরি বসুধরে রাখে নাই খণ্ড ক্ষুদ্র করি। আমার মনে হয় আমরা সকলে মিলে পারবো। We all will win together. We just need not to become panicky and stop infodemic before controlling pandemic. Thank you very much, Sandeep sir. Over to you.
Thank you so much, Dr. Bhattacharya, for being with us today and giving your invaluable time. So thank you so much once again. Our next speaker today is Dr. Shnaoli Chakraborty Acharya. Dr. Acharya did her master's in English, and she stood first class first in MA from Kalyan University in 2004-2005. She did her PhD in education. Her research areas comprise of inclusive education, leadership and management in education, and blended approach of teaching and learning. She is presently working as an assistant professor in the Department of Education in West Bengal State University. Dr. Acharya has presented her research articles in several national and international seminars and conferences, and also has published significant research articles in reputed research journals with impact factors. She has also co-authored a book entitled Enhancing Achievement in English Learning from Lapp Lambert Publishing House, Germany. Dr. Acharya is holding the position of chairperson in West Bengal Chapter Council of Educational Administration and Management, Kerala, India, as well as she is an executive member of Commonwealth Council of Educational Administration and Management, India. Today, we also have with us Dr. Krishnendu Munshi, Assistant Professor of Education, Haji A.K. Khan College, Murshidabad. So the next interactive session will be moderated by Dr. Munshi after the speech of Dr. Chakraborty Acharya. Thank you. Here I would to mention again that Dr. Acharya would deliver her lecture for approximately half an hour. And during this time, if you have any questions, you can ask your question through YouTube live chat box. And after the talk, we will take some of your questions and discuss. Thank you. Now, I would like to invite Dr. Acharya to come to the web desk and deliver her lecture. Thank you, madam.
Thank you, sir. Am I audible? I would like to ask, am I audible,
Yes.
sir?
Yes, yes. Yes.
So first, I would like to share my PPT and I'll start talking.
Ma'am, share
Is
it.
it visible? Is it visible or not?
No, no. We can't share content. That option. Ma'am, please open WebEx, ma'am. WebEx icon.
WebEx. Okay.
WebEx.
Is it now visible? Is it now visible?
No, no. WebEx আসুন ম্যাম নিচে আইকনটা ক্লিক করে WebEx আসুন
এবার করলাম এক্ষুনি। Okay, then PPT. Is it now okay? Is this now okay?
Still now not coming, ma'am.
Not coming. Okay, I'll minimize this one.
ওপেন ওয়েবএক্স ম্যাম ওয়েবএক্সটা ওপেন করুন নিচে ওয়েবএক্স আছে আইকনটা তারপরে থার্ড শেয়ার কন্টেন্ট থার্ড অপশন নিচে থেকে থার্ড অপশন শেয়ার কন্টেন্ট দেন শেয়ার স্ক্রিন ওকে ওকে
Is it okay now?
না আছে না আছে ওকে ফুল স্ক্রিন ম্যাম
Yes, it's okay, ma'am. Just make it full screen.
Okay, slideshow and okay. Is it okay now?
Okay, ma'am. Continue, ma'am.
Okay. Respected chairperson of the webinar organizing committee, Dr. Sujata Bagchi Banerjee, Principal Krishnath College, Baharampur, Murshidabad, West Bengal. Respected co-chair, Dr. Ranjan Bhattacharyya, Associate Professor, Murshidabad Medical College and Hospital, other members of the organizing committee of this webinar, my colleagues and my dear participants who are there in live YouTube. A very cordial good afternoon to one and all. At the outset, I congratulate the KN College fraternity for organizing such a national webinar and selected such a wonderful theme, which is much relevant in the present crisis situation that is prevailing all over the world. At the same time, I would like to extend my best wishes to them for securing grade A by NAC accreditation. Today, I feel privileged and honored to get this opportunity to present myself before you all in this virtual platform and share my views on the selected theme of the webinar, that is restoration of mental health and hygiene in the COVID-19 affected world. So at the outset of my discussion, I would like to focus on the 4 questions that I have framed to proceed my lecture in the due course of time for 30 minutes. So the 4 questions are: why mental health is an important component of mental well-being in the COVID-19 affected world? Number 2, how would we conceptualize mental health? Number 3, what does the research say about the mental turmoil taking place in this situation? And finally, number 4, how mental health could be nurtured and restored.
Now proceeding towards the answer of my first question, why mental health is an important component of mental well-being in the COVID-19 affected world. The Interagency Standing Committee, that is IASE, a committee formed under World Health Organization, that is WHO, in their interim briefing report while addressing mental health and psychosocial aspects of COVID-19 outbreak, they has summarized some points. They have shared some specific areas in which people usually get worried in these pandemic situations. Let me brief them. That is some common responses of people affected, both directly and indirectly, such as fear of falling ill or dying, avoiding approaching health facilities due to fear of becoming infected while in care, fear of losing livelihoods, not being able to work during isolation, and of being dismissed from the work, fear of being socially excluded, feeling powerless in protecting their loved ones, fear of being separated from the loved. Excuse me?
Noise coming from outside. From
Okay,
your end.
okay. Would you excuse me for a few seconds, please?
Okay, ma'am. Okay.
Okay, just a few seconds.
প্রোটোকল দিচ্ছি এথিক্স কমিটিকে একটা অ্যাপ্রুভ করে নিন
Please wait. Thank you all participants for joining the session. Already 315 people watching from YouTube. Thank you all on behalf of KN College, Murshidabad, West Bengal.
Thank you all viewers who are watching our program here. Yes, we tell everyone, be positive and think positive to restore our mental health.
Hello. I'm extremely sorry for the noise disturbances that was coming from outside. I think I would have now made it right way. Now coming to my point again. So I was speaking about why some common responses from the people that have affected both directly and indirectly. So people are getting fear from various kinds of societal disturbances or societal different kind of livelihoods. They are about to leave this situation. That is feeling powerless in the protecting loved ones, fear of being separated from the loved ones, refusal to care for unaccompanied or separated minors, people with disabilities or the elderly due to fear of infection because parents or the caregivers have been taken into quarantine. Again, fear of reliving the experience of the previous pandemic as well. So all these worries and a different way of leading life is creating a sense of anxiety within the people. They were not at all ready for this kind of situation they are encountering now, and in such unprecedented situation and the various restrictions that are imposed to them by the government as well as by the society is really getting very heavy for them all of a sudden. The norms of the social distancing and isolation is creating a sense of uncertainty in them. Common people are now not in a stage to trust even their near and dear ones. They are always chased by a sense of disbelief and distrust, and this ultimately results in a sense of uncertainty in them. When we face uncertain situations, our mind dwindles in a dilemma and our mind gets disturbed. Thus, in a world of uncertainty, people tend to get panic. Thus, minds get disturbed in a scary situation and mental health issues arise. And as we all know that as when our mental health gets disturbed, we get physically disturbed as well. We tend to get physical discomfort for the different kind of mental issues we undergo. As healthy mind is the key to the healthy body. So let me link my point of view with a research. That is, a positive mental health is a set of key domains encompassing well-being and positive states of mind. It has been supported by research. The research done by Cooper, Marmot, and Hemingway in 2002, Carson et al. 2002, they have shown that there are links between depression and anxiety and cardiovascular and cerebrovascular diseases. The role of mental disorders in increasing vulnerability to physical morbidity and poorer outcomes is well documented according to their study. Psychological beliefs such as optimism, personal control, and a sense of meaning are known to be the protective of mental health as well as physical health also. Even unrealistically, optimistic beliefs about the future may be health protective for men infected with HIV. Similarly, physical health is a positive attribute influencing both mental and physical illnesses and their outcomes. These interrelationships are encompassed in holistic concepts of health and culture. So our mental health is now disturbed and our mental well-being is now gets disrupted by the sanitization norms, the social distancing norms, and the home isolation which are compelled to do. Now moving on to my second question. How would we conceptualize mental health? So you know that there is no health without mental health. Mental health, I would like to refer to the definition, none other than by World Health Organization, that is WHO. They have stated that a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. In this positive sense, mental health is the foundation for well-being and effective functioning for an individual as well as for a community. This core concept of mental health is always consistent with its wide and varied interpretation across all the cultures. And again, this is to mention that mental health is determined also by the socioeconomic and environmental factors as well. Mental health and mental illnesses, they are determined by the multiple and interacting social, psychological, and biological factors as well, just as health and illness in general. And also to add one more point to it, that mental health is also linked to behavior. That is, mental, social, and behavioral health problems may interact so as to intensify their effects on behavior and well-being, such as substance abuse, violence, and abuses of women and children on the one hand, and health problems such as heart disease, depression, and anxiety on the other are more prevalent and more difficult to cope with in conditions of high unemployment, low income, limited education, stressful work conditions, gender discrimination, unhealthy lifestyle, and in human rights violations. These are all the factors which we very often come across in our renowned dailies every day. Now moving on to the third question. What does the research say about the mental turmoil taking place in this situation? So let me focus on only the two studies. Because of the paucity of time, I am not able to mention so many of that, but only to focus on the research studies, two taken globally. One is an online survey conducted in China looked at the immediate psychological responses and associated factors during the initial state of the COVID-19 epidemic among the general population of China. of 12,1210, that is 1210 respondents, 53.8% rated the psychological impact as moderate or severe. 16.5 reported moderate to severe depressive symptoms. 28.8% reported moderate to severe anxiety symptoms, and 8.1% reported moderate to severe stress levels. Therefore, mostly 84.7 respondents spent 20 to 24 hours a day at home, and 75.2 were worried about the family members contracting COVID-19. Moving on to the second research. This is another study looking at the emotional indicators in a group of Weibo users before and after the declaration of COVID-19 on 20th January 2020. They found that negative emotions such as anxiety, depression, and indignation and sensitivity to social risks increased, while the scores of positive emotions and life satisfaction, they have decreased. People were concerned more about their health and family and less about their leisure and friends, which was very much stressed as the tips for healthy living by my core resource person, Dr. Bhattacharya. Now, moving on to the Indian scenario. An ongoing qualitative study at the Department of Psychiatry and Department of Community Health of Christian Medical College in Vellore shows that existential questions of survival and death mainly rise out of fear of uncertainty and are compounded by various sources of misinformation. An active role, primarily of researchers, healthcare professionals, and the media, is necessary to disseminate facts at the grassroots levels and prevent medical mistrust, which has further adverse consequences so far. And again, another research that is impact on students, how it has impacted, how this situation has impacted on students. A research has been made on that. It shows that the COVID-19 crisis brought a unique dilemma to the student fraternity, as we all belong to the educational sector. We know this very well, in what kind of uncertainty the students are undergoing these days. So with the colleges and universities closed, the students were left with no option but to move to their homes hastily. In most of the cases, it was mandatory to leave the hostel, while in some other cases, the students were allowed to stay with requisite permissions if their home are very far away from their home or like that. These sudden changes have brought immense agony to the students, which are already burdened with the semester and competitive exams, research and academic activities as well. Now, moving on to some views around the concept of positive mental health. These are the various kinds of views coming out from the psychological background. First is view in respect of culture. Jahoda in 1958, she elaborated on the 1947 WHO declaration that health is not merely the absence of illness, but a complete state of physical, psychological, and social well-being, by separating mental health into three domains. First is the mental health involves a self-realization, in that individuals are allowed to fully exploit their potential. So mental health helps in the self-realization as well. Second, mental health includes a sense of mastery by the individual over their environment. That is what we could refer to in a single word. That is, we call psychologically the adjustment process. And finally, the positive mental health also means autonomy, as in individuals having the ability to identify, comfort, and confront and solve problems. Others like H.B. Murphy, 1978, he also argued that these ideas were laden with cultural values considered important by North Americans. The definition of mental health is thus clearly influenced by the culture that defines it. Mental health has different meanings depending on the setting, culture, socio-economic, and also the political influences. Moving on to the second view as impact in the affective domain. So positive mental health can be conceptualized as a subjective sense of well-being. Bradburn, 1965, devised a scale to measure the positive and negative facets of psychological well-being. Later work researching the definition and determinants of subjective well-being suggest that it has more effect on the environment than the environment exerts on it. Next view is in respect of resilience. The capacity to cope with adversity and to avoid breakdown when confronted by stressors differs tremendously among individuals. Not all responses to stress are pathological, and they may serve as coping mechanisms. Numerous researchers have studied healthy mechanisms of defense and coping. We know that there are theories regarding coping stresses. I'm coming to that also. Rutter in 1985 conceived of resilience as a product of environment and constitution that is an interactive process. Protective factors can modify a person's responses to an environmental hazard so that the outcome is not always detrimental, and protective factors may only become detectable in the face of a stressor. Stress coping, I would like to elaborate a few on this stress coping mechanism. Stress coping, as described by researchers such as Lazarus and Folkman, implies a more specific process of cognitive appraisal, that is, the act of assessing someone or something, to determine whether an individual believes he or she has the resources to respond effectively to the challenges of a stressor or a change. The appraisal literature explains more that the response or the coping process in terms of problem-focused coping or emotion-focused coping. As well, approach and avoidance style measures of coping exist involving, that is, showing a confident and forceful personality or withdrawn. When faced with a challenge, let me exemplify it. When faced with a challenge, an individual primarily appraises the challenge as either threatening or non-threatening, and secondarily in terms of whether he or she has the resources to respond or cope with the challenge effectively. So it comes from within. If the individual does not believe he or she has the capacity to respond to the challenge or feels a lack of control, he or she is most likely to turn to an emotion-focused coping response, such as wishful thinking. For example, I wish that I could change what is happening or how I feel. So a wishing kind of strategy we take. Distancing, that is, I will try to forget the whole thing, or emphasizing the positive, that is, I will just look for the silver lining. If the person had the resources to manage the challenge, he or she will usually develop a problem-focused coping response, such as analysis. For example, I try to analyze the problem in order to understand it better, or I'm making a plan of action and following it. Like this kind of things we make within ourselves. So it is theorized and empirically demonstrated that a person's secondary appraisal then determines the coping strategies. And now let me relate a few measures or the techniques or the stress management techniques with you. Coping with stress, how we could cope with the stress situation. So there are many ways that people strive to cope with the stresses and feelings of stress in their lives. Stress management techniques are more general and range from cognitive side, that is mindfulness, cognitive therapy, meditation, to the physical, that is yoga, art, natural medicine, deep breathing, to the environmental, that is spa visits, music, pets, nature, etc. Then moving on to the view in respect of personality types. Layton and Murphy in 1987 defined various personality types and their coping strategies. They hypothesized that, well, people have different coping strategies, some of which can be relatively unhealthy and when challenged may put individuals at risk for mental illness. Moving on to the views in respect of salutogenic approach. Antonovsky proposed the salutogenic approach that focuses on coping rather than breakdown, and salutary factors, that is, when we salute someone, pat someone's back for doing something well, that is the salutary factors rather than the risk factors. he viewed stressors as having the potential for positive, neutral, or negative consequences. A sense of coherence is considered to be vital to positive mental health as it involves a capacity to respond flexibly to the stressors or the substance that is making us feel stressed. Optimism appears the dominant cognition of the mentally healthy, and optimists have been found to have better coping mechanisms. Those who have optimistic vision, they are found to have better coping mechanisms such as acceptance of reality and reliance on personal growth. And the salutogenic approach is one that focuses on factors that support health and well-being beyond the more traditional pathogenic focus on risk and problems. And this approach is widely used around the world in health, education, workplaces, architectural design, and we believe it has enormous relevance in dementia care also. Let me utter a few words regarding dementia, as a lot of participants are there. Dementia is a chronic or persistent disorder of the mental processes, mental disorder caused by the brain disease or injury and marked by memory disorders, personality changes, and impaired reasoning. So this salutogenic approach is supposed to work well with people suffering from dementia. And now let me move on to view in respect of psychoanalytical approach. This approach is very much known to us. The psychoanalytical approach proposes positive mental health criteria as the person's capacity to use their internal energy for the realization in emotional, intellectual, and the sexual domains. Perhaps the most impactful idea put forward by Freud was his model of the human mind. Let me summarize his ideas, and the concepts will take minutes after minutes to cover up. Let me summarize it with only a few points. His model of the human mind, his model divides the mind into three layers, that is the conscious, preconscious, and the unconscious. And later, Freud posited a more structured model of the mind, one that can coexist with the original ideas about the consciousness and unconsciousness. I will elaborate that in few words. In this model, there are three metaphorical parts of the mind. That is the id, ego, and the superego. The id actually operates at the unconscious level and focuses solely on instinctual drives and desires. Two biological instincts make up the id. According to Freud, one is eros and another one is thanatos. Eros, or the instinct to survive, that drives us to engage in life-sustaining activities, and thanatos just is the opposite. On the contrary, it is the death instinct that drives destructive, aggressive, and violent behavior. Then comes the ego. The ego acts as both a conduct for and a check on the id. Working to meet the id's needs in a socially appropriate way, it is the most tied to reality and begins to develop in infancy only. And finally, the superego, the domain. The superego is the portion of the mind in which morality and higher principles reside, encouraging us to act in socially and morally acceptable ways. So this has been shown in the iceberg model, which is, I think, most of our participants from the education domain might be well acquainted with. I'm not going deeper into it. Let me come to the defense mechanism, or the defense mechanism as pointed out by Freud. There, I would only name a few of them and stress only a defense mechanism that is very much related with coping the stress. So the defense mechanisms include repression, denial, projection, displacement, regression, and sublimation. Out of all this, regression is a kind of defense mechanism. The individual in defensing with this regression mechanism, the individual moves backward in development in order to cope with stress. For example, an overwhelmed adult starts acting like a child. So it is the way of regressing from the present situation to backward situation. Then moving on to the final view, that is quality of life, view in respect of quality of life approach. This is again a life approach, quality of life, which is defined by who as an individual's perception of his or her position in life in the context of the culture and value systems in which he or she lives, and in relation to his or her goals, expectations, standards, and concerns. This definition reflects a broad view of well-being, encompassing the person's satisfaction with social, environmental, psychological, spiritual, and health status. The concept of quality of life describes health, including mental health, in terms that capture positive as well as negative aspects of coping, resilience, satisfaction, and autonomy, among the others. So here data has been shown showing the media, social media users, and it is reported here that mostly the children or the people in between 14 to 24 years old, they are reported on the impact of well-being. So the positive and the negative, two aspects are there, and four social media has been shown here. One is the Instagram, Snapchat, Facebook, and Twitter. And let me point out, there are different kinds of our mental states been explained here, been stated here. So in the negative aspect, if we consider the negative aspect, one, our sleep is mostly disturbed by the Facebook, not our. I should again mention that the children or the people within 14 to 24 years old, their sleep is mostly disturbed by the Facebook. Fear of missing out is mostly happens when they are mostly used to Snapchat. Bullying is mostly seen when people are using Facebook. Their body image is mostly disturbed in case of using the Instagram. Their anxiety level rises to a highest using the Instagram. Their depression level again rises to the highest, both in Instagram and the Facebook, and their loneliness could be seen mostly when they use the Instagram. Also, these have some positive aspects also, the positive sides, access to health advice. This is more or less the neutral, showing the neutral kind of data. The self-expression is mostly, they get the mostly self-expressed when they use the Instagram. Their self-identity is mostly expressed while using Instagram as well. They get emotional support from Facebook, most excitingly to note. Community building is mostly done in the Facebook, and awareness of people health, they get mostly from the Facebook as well. Now moving on to my final question. How mental health could be nurtured and restored? So coming on to certain points which I have jotted down, how to maintain good mental and emotional health as well. So it's my suggestion on my part that beware of your emotions and reactions. We should be very much aware of how we are reacting to other people, and psychologically it can be called the emotional intelligence, the way of managing our emotions and the others' emotion as well. Express your feelings in an appropriate way. So we should not hide within ourselves what we want to express. We should be open to all and express our feelings in appropriate ways. We should think before you act. So it is the most wise way to act with other people. We should think before we act. We should manage stress. This is another way, another dimension, I should say, another dimension of emotional intelligence, that we should manage our stress as well as the stress, manage the stress of others who are in front of us or while we are encountering with some other people. Strive for balance. So a balance should be there. Say I could cite example from our life only, that we should strive a balance between our professional life and our domestic life. Children should strive a balance between watching TV and studying and playing in the playground, and like this. Take care of your physical health. This is the most neglected side of our life when we were in the offline mode, and again when we will be again joining in our institutions in the coming days. So we stress so much on our work, we stress so much on our lives, we stress so much on the duties that we are supposed to perform. We forget to take care of our physical health. Connect with others. If we cannot connect physically, there are so many, we could take the help of different kind of social media, and we could take the help of telephones and all these things, so that we could connect with others and find purpose and meaning. Whatever we do, we should first conceptualize that what will happen if I do this, or what is my goal of doing this. So we should find the purpose and meaning that would make us act better and in a wise way. And finally, what the education could provide us, what we could expect from the education sector in combating the situation and in nurturing our mental health and well-being. I would like to refer to Education for Sustainable Development. Education for Sustainable Development was a United Nations program that defined as education that encourages changes in knowledge, skills, values, and attributes and attitudes to enable a more sustainable and just society for all. To promote education for sustainable development, the United Nations Decade of Education for Sustainable Development 2005 to 2014, DESD, the initials, was adopted by the UN General Assembly with the United Nations Educational, Scientific and Cultural Organization, that is UNESCO, designated as the lead agency for promotion throughout the decade. The decade pursues a global vision of a world where everyone has the opportunity to benefit from quality education and learn the values, behavior, lifestyles for a sustainable future and for positive societal transformation as well. There are a number of key themes involved in education for sustainable development. While the dominant focus is on the environmental concerns, it also addresses themes such as poverty alleviation, citizenship, peace, ethics, responsibility in local and global contexts, democracy and governance, justice, human rights, gender equality, and so on. It is generally accepted that certain characteristics are important for the successful implementation for education of sustainable development, reflecting the equal importance of both the learning process and the outcomes of the education process in the near future. So here are some points jotted down that has been adapted from UN Decade of Sustainable Development, UNESCO Nairobi Cluster 2006, that education for sustainable development should be embedded with the curriculum. This is a kind of developmental approach that has to be seen in the coming days, or we are also having this in our present curriculum structure also, that education for sustainable development should be embedded in the curriculum in an interdisciplinary and holistic manner, interconnected manner, allowing for a whole institution approach to policy making. Secondly, share the values and principles that underpin sustainable development. So this kind of education should share the values and principles that should underpin sustainable development. The education should promote critical thinking, problem solving and action, all of which develop confidence in addressing the challenges to sustainable development. Again, it should employ a variety of educational methods such as literature, art, drama, and debate to illustrate the processes. It should allow learners to participate in decision-making on the design and content of educational programs. It should address local as well as global issues to avoid jargon-ridden language and terms. And finally, it should look to the future, ensuring that the content has a long-term perspective and uses medium and long-term planning. Now, finally, coming to a few tips for connecting to others. Call a friend or loved one now to arrange to meet up. I cannot call this a part of education for sustainable development, but for the participants, I should say that this is the way of connecting sustainably to others. Call a friend or loved one now and arrange to meet up. If both of you lead busy lives, offer to run errands or exercise together. Again, if you don't feel that you have anyone to call, reach out to the acquaintances. Lots of other people feel just as uncomfortable about making new friends as you. You should get out from behind your television or computer screen. Communication is largely non-verbal experience that requires you to have direct contact with other people. So don't neglect your real world relationships in favor of virtual interactions. Be a joiner. Join networking, social or special interest groups that meet on a regular basis. These groups offer wonderful opportunities for meeting people with common interests, and don't be afraid to smile and say hello to strangers you cross paths with. Making a connection is beneficial to both of you, and you never know where it may lead you in the coming days. So that's all for today. Thank you for your patient listening. See you. Over to the organizers.
So this hello.
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 Krishnath, sir. Yes, continue.
So on behalf of the organizing committee, we are conveying our heartfelt thanks to Dr. Shnaoli Chakraborty Acharya. Thank you, ma'am. It's no doubt presentation. We have really enriched a lot. So relevant topic, so relevant presentation. Thanks again from all over here. And now, ma'am, we have offered a small interactive session for the viewers and YouTube. We have collected some questions, lots of questions are there, and this is also a good sign, of course. And from that, I
Please
will.
turn on your video. Please turn on your video. Sir, please turn on your video.
Yes. Yes. Yes.
Okay. Still not coming.
Krishnendu sir, you are not visible now. Please turn on your video. It is there on the screen.
I've turned it on.
And start, click on start video.
No, it is not coming.
Okay, sir, continue.
You are not visible now. Continue. You are not visible now.
Yeah.
Okay, sir, continue.
I think now it is okay. Am I visible?
Yes. Yes.
Okay.
Camera position.
Is it clear now?
Okay,
visible?
Sir. Okay, sir.
Visible now.
Okay. Okay. My heartfelt Dr. Shnaoli Chakraborty Acharya. Brilliant presentation, and we have enriched a lot. And now there's some question from the. I'll place them some before you. First question is from Parijat Islam of Vishwabharati. Parijat asks that my student cannot understand what social distance is. How to explain it to them? How to make them safe by making them aware about social? Ma'am, would you please give a response?
Sure. So I would like to again ask him a question that your students, would you please mention the age group of your students? That would make me easier to answer. Because we have to teach differently the school students, and in another separate way we teach the higher education, means the students belonging to higher section. So I would like to ask him, your students belong to which age group?
On behalf of him, I can say that we should deal with the higher education students here.
Higher education students. So they are not getting to understand what does social distancing mean. Is this the question? Is this the question?
Yeah. But they should. I think they should.
Okay, I check YouTube chat box. You may continue next.
And
okay. This is. Now
okay,
I think the participants and the organizers could get that the students belonging to the higher classes, that is the colleges and universities, it is really very ridiculous that they don't get at all the meaning of social distancing.
Madam,
Dr. Anuradha Paliwal. Dr. Anuradha
class
Paliwal.
6 to 10. Class 6 to 8
Oh.
and
Yes, yes. That's why I'm asking what age group he is belonging. Yes. So if he is not getting the meaning of social distancing, what we could do is to exemplify him or her by acting ourselves. What we do, they learn from that more that they learn from their textbooks. So if we maintain social distancing in our lives, say if I'm a parent of a class 6 student, if I practice social distancing in my life, in my family life, I stop going outside, I stop taking groceries or say vegetables from the vendors coming in front of my house, in my gate, and say even ask my relatives and friends that please don't visit my house during this pandemic situation. I think a child or a boy or a girl of class 6 would then get the meaning or realize the meaning that what does social distancing mean. Sometimes it get difficult to make them understand by theory. So it is by practice we could make them understand.
Thanks a lot, ma'am. Another question tendered by Dr. Abhijit Brahmachari of Rashtraguru, Barakpur Rashtraguru Srinath College, and he is asking, instead of social distance, if we follow physical distance, then mental pressure on the student will be reduced more. This is his question.
Okay. So if we follow the physical distance instead of social distance, so let me clarify, this is kind of overlapping. This question is overlapping because if we maintain physical distance, actually we are maintaining social distance only, isn't it? Because our physical entity is a part of society only. If we stop ourselves going outside the house, that means we are not involved in the socialization process. We are not coming in contact with our neighbors. We are not coming in contact with our colleagues and with our friends. So it is only physical distancing, I think, is only a part of social distancing. Also, social distancing involves many other things. And what his question is, why don't we maintain physical distancing? So while maintaining social distancing, are maintaining physical distancing, as well as we are maintaining certain norms, which is essential for us to maintain in this kind of unprecedented situation, the situation for which we are not at all prepared for. It's because it is so much it came out as so much an emergency, government has only imposed such kind of norms. So I found nothing better to maintain the norms of social distancing. Thank you.
Another question is there from Enamul Kobir Pasha, Assistant Professor, Sripot Singh College, and he is a students who are unable to join the online classes.
Sound is, Dr. Munshi, you are not audible now.
Krishnath sir.
Dr. Munshi is not audible now.
Devasi Square, how will we protect our learners from sorry.
Am I audible?
Could you, yes, you're audible now.
Continue, sir.
Put in the chat box also.
Hello?
Yes.
Have you got the question, ma'am?
No.
Have you?
It was only half done.
Oh,
no. I didn't get the question.
Okay. Then
I'm
repeating it. I'm repeating it. It's from Enamul Kobir Pasha. He is asking that depression may also occur to students who are unable to join the online classes for various reasons during this period. How can they overcome this?
So it's a matter of
College.
Absolutely, it's a very much matter to get concerned as because we also are facing the similar kind of experiences, that when we are supposed to take online classes in our universities, there are many students who are keep on complaining that, madam, we are not getting connected with you. So I would, this is actually a part which is not dealt by the teacher. Still, as I am as a responsible citizen as well as a responsible teacher, I should suggest the way out in my way. That is, as a teacher, different way out could be chalk out. Say, for instance, while taking online classes, if the student is not getting connected, we could connect him through the WhatsApp group or some other way. Say for recorded sessions, we could record our lectures and post it in the WhatsApp group, so that when they would be getting more connected, or say if the area is suffering from low connectivity or low bandwidth, like such problems, he or she could get the resource material whenever she is getting the provision of getting that. So in this way, I also used to practice this way, and I would like to suggest that teachers should try their own way and come out with their innovative ways, how they could connect the students in this emergency situation, I should say.
Thank you, madam. We should adopt whatever we can. So the next question thrown by Dr. Anuradha Palial, Assistant Professor.
Sir, is last question, sir.
This may be the last question.
This may be the last question. Yes, yes.
Okay, but this question should go to our first resource person, Dr. Bhattacharyya, because he is asking that.
Yes, I'm here. Yes, I'm here.
How many? Because we are lucky enough to, that we have experienced two approaches, one from psychiatric approach from Dr. Bhattacharyya, and other the academic approaches by from Dr. Acharya. And she is asking how many times suffered with COVID-19 approximately. How long? I think.
Yes, I got the question, sir.
Yeah,
yes.
Yeah.
Thank you very much for this question. How much it depends on that the certain infections once affect human being, so it gives lifelong immunity. Most of the viral infections, once a human being is exposed to that, it develops antibody titer, and that antibody titers makes the person immune to lifelong. For example, measles or chicken pox, these are the viruses. When affects an individual, that we develop the lifelong immunity. But as I mentioned in my initial slide, that Chinese with Chinese letters, many things about the COVID-19 are still unknown. Only in the due course down the lane we will be able to know that whether this gives a lifelong immunity. As I mentioned, unlike the SARS virus which affected 2002, unlike the MERS which has affected 2012, the SARS-CoV-2 or the novel coronavirus has got lots of antigenic variations. At least 25 coding changes has occurred. It's an ssRNA vaccine, RNA virus, that is single-stranded ribonucleic acid virus. There are two kinds of viruses, RNA viruses and DNA viruses, and it could have again divided into single-stranded and double-stranded. So single-stranded RNA virus, it has affected. There are lots of codon sequences are there at the genetic level. We're still unaware of whether it will develop. It will give the lifelong immunity. In fact, if the vaccine is developed, how long it will protect us, because many vaccines, the seasonal influenza vaccines, are not giving the lifelong immunity. In those cases, we have to give the booster dose to our patients. And just if you allow me 2 more minutes, just 2 more minutes to respond certain brilliant deliberations and question asked after the wonderful presentation of Madam Shnaoli Chakraborty Acharya. So there are one question asked by Dr. Parijat Islam of the social distancing versus physical distancing. So physical distancing terminology is more acceptable, because social distancing gives sometimes stigma. There is some stigma associated with. Somewhere it is implying that we are rejecting that person, not socially accepting that. That's why socially distancing that individual. So it is better to give the nomenclature. The argument given in favor of physical distancing is that that we shouldn't disrespect a human being. And as WHO and CDC has given their in their guidelines that distancing of 1 meter by WHO and at least 2 meters by CDC is favorable. That there are different educational psychology is a very fast growing subject, as we know, being the teachers who are already being taught about this. So educational psychology taught us lots of important things. There are various modes of teaching, like the traditional didactic lecture theory, the chalk the talk method. Now we have gone through the overhead projector, then come to the PowerPoint mode of presentation. So then coming to the webinar. As mentioned, what will happen to the peripherally located, deprived, underprivileged students who are not getting the 4G networks to get connected to attend the all webinars? It's really frustrating, as mentioned in one of the questions. There are various modes of teaching. We can send the course material, because it is not, we do not cover, the teachers do not cover entire syllabus in their classes. They just ignite to learn more important key salient points are being taught in the classes. As mentioned already, there are certain human factors, like that we practices defense mechanism as described by the Sigmund Freud. We have mature defense, immature defense, and psychotic defense mechanism. If we just practice the mature defense, that is the humor or sublimation. For example, just think about the Charlie Chaplin. Charlie Chaplin, the versatile actor, during the phase of the Second World War, he had nothing to do to protest against the Hitler. So what he did, he just portrayed the beautiful character in The Great Dictator. So these are the beautiful Leonardo da Vinci, Vincent van Gogh. They have drawn the lots of in their creativities. In fact, Vincent van Gogh has been known to suffer from the bipolar mood disorder. In the manic phase, he used lots of colors in his portrayal. But during the depressive phase, only the darkness, the black and white colors do come. And resilience is very important. Resilience is like an elastile state. In the physics, we have known for the elasticity. So the more having if you have the more elastic strength, you will come back to any adversity. Those who are not having that that elastic strength, they will definitely in the disadvantaged position. And last but not the least, we are now in the era of the telemedicine, tele-education. We also should learn the tele-etiquette. There are various tele-etiquette and principles are there. If we just follow the principles, I think the tele-education will be the call for the day for the next decade to come. Thank you very much.
Hello, am I audible?
Yes.
Thank you, Dr. Munshi, for. Hello.
Yes. Continue.
Achha,
Sandeep,
are you going to say something, Dr. Munshi?
Sandeep,
Acharya
continue.
1 minute. I think both the resource persons have satisfied all the viewers. Dr. Sandeep More, who is conducting the program smoothly from the very inception of the program. I just like to thank our respected
network issue.
theme and giving me a chance to be a part of it. And now over to Sandeep sir.
Am I audible?
Yes.
Yes, you're audible.
Thank you, Dr. Munshi, for conducting this session. We really appreciate your presence today. So now we have come up to the end of this, and I would like to thank both of our speakers for delivering wonderful speech and for giving their invaluable time. So, as we have discussed today about COVID-19 and its problems and remedies and the mental health and hygiene, so nowadays each and every one of us are talking about COVID-19. But actually, we have to see the positive side of this rather than the negative sides. So, being a host, I want to end this program on a positive note, and I want to say that when the headlines of rising death pressurizing us, just look outside the window and look at the night sky filled with stars, listen to the birds, breathe in the clean air. And this is the coronavirus silver lining. So it's a forced detox of the planet Earth. And it has been principle of coexistence. We come out of this lockdown as more responsible human beings and we learn to coexist. Think about it. Thank you. So all the participants are also informed that their respective certificates would be provided to them within 15 days by email. And finally, I would like to request Dr. Niti Mullah to propose vote of thanks. Thank you.
Okay, Sujan, am I audible?
Yes, ma'am. Continue.
Okay. Okay, then now we are coming to the end of the program. I, Niti Mullah, on my behalf, as well as on behalf of Organizing Committee, express my heartfelt gratitude to resource person for sharing time out of their busy schedule. I convey special thanks to Kane College Authority, especially Principal Madam Dr. Sujata Banerjee for extending all cooperation to make the webinar successful. I acknowledge all the other members of Organizing Committee and participants for their valuable contribution. I appreciate and thank Mr. Sujan Shaha for technically supporting and making this webinar a smooth and successful one. Thank you all once again. The webinar comes to an end. Take care.